Hi, my name is Dr. Paul Nassif. I'm a Beverly Hills facial plastic surgeon specializing in rhinoplasty, and I wanted to answer some of the YouTube questions that get sent to us all the time. And this one is from Susan from Santa Ana, California. She goes, I'm African American and I wanted a rhinoplasty. And how does rhinoplasty differ for patients with different skin types, different ethnicities? And that's a great question. Previously, many patients would come and say, I want a westernized rhinoplasty, and that's usually basically taking someone's characteristics of their ethnicity and almost removing them, making them look completely Caucasian. But most people in the last 7 or 8 years don't want to do that. They want to retain some of the ethnicity, but at the same time soften the features and give it a little bit more of a Caucasian hint. That's the general description or definition of what we call an ethnic rhinoplasty. Now, when we talk about that, in general, many patients usually will come in, let's say they're Asian or African American, and they need a taller bridge, less wide, smaller tip, less wide nostrils. In general, those are the 4 main things. What we'll do usually is we'll work on the tip to soften the tip, because usually the skin's very thick. So sometimes we have to add grafts to the tip of the nose to take a nose that's not projected, that's close to the face and wide, and we have to push it out further with grafts and pieces of cartilage. If we do that, the nose usually will become taller and more narrow. Once we do that, we'll narrow the nasal bones. We'll make what we call a diced cartilage fascia implant. We'll take tissue from your scalp and cartilage. We'll dice up the cartilage and pretty much make like what we call a burrito. Add that here to build up the dorsum. And the last part of this will be the alar base reduction. That's making the nostril smaller. We'll usually make an incision right here on the side, and this heals beautifully if it's done properly. Sometimes we go inside the nose right here too, called the nasal sill. This is called a Weir incision, followed by possibly a sill incision. And I have plenty of these on my websites. I have actually the videos of alar base reduction, but these are the basic characteristics. For sometimes Hispanic noses or Mediterranean noses, our goal would be more of a reductive, where the tip is large and there's a huge hump, we'll soften that. So every ethnicity is different, and actually of all the different Asian societies, each one of these different groups have special things they want. So I have to listen to the patient to make sure that we listen and get their concerns addressed at surgery. Okay, thank you.